Gentlemen, imagine this. A simple gel, yes, just a small amount applied directly to the penis, can help you achieve an erection in as little as 10 minutes. No prescription, no awkward pharmacy visits, no waiting around for a pill to take effect. Sounds almost too good to be true, doesn't it? Well, today, we're diving into a brand new FDA-approved topical gel that is already changing the way men address erectile dysfunction. But here's the important part. While this gel can be a game changer for many men, it is not magic. It is not for everyone. Before you rush out to buy it, let's separate the facts from the hype. And quickly, before we go further, if you value honest, no-nonsense men's health advice, hit that like button, subscribe, and drop a comment below telling me where you're watching from. I love seeing our community of men from all over the world come together here. Now, here's something critical. Erectile dysfunction is not just about the penis. For years, men have been told it's purely mechanical, just a plumbing issue. Take a pill, fix the pipe, problem solved. But the truth is far more complex. Erections are the result of a finely tuned symphony involving your brain, your nerves, your hormones, your emotions, and yes, your blood vessels. When even one of these instruments is out of tune, stress, high blood pressure, low testosterone, prostate changes, performance can suffer. That's why I always remind my patients, ED isn't just a bedroom inconvenience. It's often an early signal about your cardiovascular health. It can quietly warn you that your blood vessels aren't functioning optimally. So when something new, like this topical gel, hits the market, my job is to help you understand not just how it works, but how it fits into the bigger picture of your health and confidence. If you're new here, hi, I'm Dr. Narita, a board-certified urologist with 12 years of experience helping men reclaim vitality, protect their prostate, and strengthen both their health and their relationships. I've sat across from thousands of men in my clinic, men in their 40s, 50s, 60s, and beyond who quietly struggle with ED but don't always feel comfortable talking about it. So, consider this video your private consultation, from me to you. We're going to talk openly, honestly, and without judgment. Now, let's break this down into 3 essential parts. Before you even think about trying this gel, you need to understand how it works in your body, what the science says, the risks, the benefits, and the practical realities. So, what is this gel? It's called Erectile, a topical treatment applied directly to the glands, or head of the penis. Just a pea-sized amount, gently rubbed in for about 15 seconds. And what happens next is fascinating. First, you'll feel a cooling sensation, then a gradual warmth. That temperature change isn't just cosmetic. It stimulates the nerves in the glands to release nitric oxide. If that term sounds familiar, it should. Nitric oxide is the chemical spark that initiates an erection. It relaxes the smooth muscle inside the penis, allowing blood to rush in and create firmness. Think of it as flipping your body's natural on switch. Here's the critical part. It won't give you an erection on its own. You still need arousal. In other words, the gel primes your system, but you and your desire or your partner provide the fuel. Biologically, that's a good thing. It works with your body, not against it. All right, you're probably wondering, does it actually work? Let's look at the research. In 2023, the European Society for Sexual Medicine presented results from a clinical trial comparing Erectile with tadalafil, better known as Cialis. Over 100 men with varying degrees of ED participated. Here's what they found. About 61% of men using Erectile reported meaningful improvements in erectile function. For tadalafil, that number was 87%. Now, that doesn't mean Erectile is ineffective. The point is, Erectile clearly works, especially for men with mild to moderate ED. Another study, called FM57, looked at over 1,000 men across 60 clinics. Even after accounting for the placebo effect, which can be as high as 40% in ED studies, Erectile still performed well. Here's the headline. About 60% of men achieved an erection within 10 minutes of applying the gel. Compare that to Viagra or Cialis, which typically take 30 to 60 minutes. That speed matters for intimacy. No more waiting, no more planning, no more breaking the mood. And because the gel acts locally, it doesn't flood your bloodstream. You don't get the systemic side effects like flushed face, pounding headaches, or risky interactions with heart medications. So, what about side effects? In clinical trials, only 4% of men reported mild issues such as headache or nausea. Compare that with nearly 20% for tadalafil pills. And importantly, no serious side effects were reported. Here's what else you should know. It's safe with condoms. It won't break latex. It's safe during oral intimacy. It won't harm your partner. It's compatible with nitrate medications like nitroglycerin, which are dangerous with Viagra or Cialis. That last point is a huge game changer. Until now, men on heart medications often had no safe ED option. But let me be clear, it's not a magic bullet. About 40% of men in the trials didn't respond. If your ED is caused by advanced vascular disease, nerve damage from diabetes, or very low testosterone, this gel may not fix the root problem. And that's why I always tell men, if the gel doesn't work, you're not broken. It just means we need to dig deeper and address the underlying system. If you have mild to moderate ED, can't take pills due to side effects or medications, or want something faster and less systemic, yes, Eroxon is worth considering. But here's my professional advice. Don't stop there. Think of this gel as one tool in your toolbox, not the whole solution. Combine it with a heart-healthy diet that improves blood flow, consistent exercise, especially strength training and pelvic floor work, stress management, because high cortisol can suppress testosterone, regular prostate checkups, because your prostate health directly impacts performance. And speaking of the prostate, many men don't realize that as the prostate enlarges with age, it can quietly undermine erections and urinary flow. That's why I often recommend targeted supplements with ingredients like saw palmetto, beta-sitosterol, and pygium. They don't replace medical care, but they can support long-term prostate health alongside lifestyle changes. Now, I want to pause for a moment because I know some of you might be thinking, Doc, it's too late for me. Maybe you've struggled with ED for years. Maybe you've avoided intimacy out of fear of failure. Let me tell you something I've learned in over a decade of working with men just like you. It's never too late to reclaim your confidence. I've seen men in their 70s and even 80s rediscover intimacy after years of silence, simply because they finally found the right approach. Erections are not just about intimacy. They're about dignity, about feeling like yourself again, about closeness with your partner, and pride in your own body. So whether you try this gel or not, don't give up. You are not broken. Your body is adaptable. Your system is capable of more than you realize when you give it the right inputs. Here's my challenge to you. Don't just chase quick fixes. Build a foundation. Support your heart, your hormones, your nerves, and yes, your erections. Think of the gel as a boost, not a cure-all. It helps, but the real victory is knowing you're investing in your long-term health. Gentlemen, your best years are not behind you. They can still be ahead, full of comfort, freedom, and confidence. If this video helped, give it a like. Subscribe for more straight talk men's health advice. Share it with a friend who might need encouragement. And now, I want to hear from you. Would you try a topical gel like this, or are you more comfortable with traditional pills? Drop your thoughts in the comments. I'll be reading and responding. Remember, you deserve to feel strong, capable, and confident at every stage of life. Now, let's talk about the bigger picture. ED isn't just a bedroom issue. It's a signal. Your erections reflect the health of your heart, your blood vessels, your hormones, and even your mental state. That's why when you use something like a topical gel, it's not just about getting an erection faster, it's about supporting the system that makes those erections possible. Lifestyle still matters. Cardiovascular exercise, even a brisk 30-minute walk, keeps blood flowing efficiently. Strength training helps maintain testosterone levels. Pelvic floor exercises, even without sexual activity, keep muscles strong and responsive. Stress management is critical. High cortisol from chronic stress can silently lower testosterone and impair sexual function. A balanced diet, rich in nutrients, supports blood flow, hormone balance, and overall energy. And don't forget prostate health. As men age, the prostate naturally enlarges. This can subtly reduce blood flow, affect urinary function, and contribute to ED. Targeted supplements with ingredients like saw palmetto, beta-sitosterol, and pygium can support prostate health. They don't replace medical care, but they enhance your foundation. Now, think about the gel again. It's fast, it's local, it's convenient, but it doesn't replace these fundamentals. It's a tool, not a solution. For men with mild to moderate ED, or those who can't tolerate oral pills, it's a game changer. But for men with advanced vascular disease, diabetes-related nerve damage, or very low testosterone, it won't fix the root problem. That's why a holistic approach works best. Gel plus lifestyle, plus medical guidance when needed. And here's the mindset piece many men overlook. Sexual health isn't shameful. It's part of your overall health. If ED has caused embarrassment, anxiety, or avoidance, know this. Those feelings are common, normal, and treatable. By approaching sexual health as a component of your general well-being, you regain confidence, reduce stress, and improve intimacy with yourself and your partner. Every small step counts. Every informed decision, exercise, diet, supplements, medical checkups, safe topical aids, compounds into better function and overall vitality. The body is adaptable. It responds to care, attention, and consistent maintenance. You can improve erectile function, circulation, muscle tone, hormone balance, and mental confidence. And remember, it's never about chasing perfection or comparing yourself to your younger self. It's about taking control, being proactive, and investing in your health so you feel capable, proud, and confident at every age. Finally, let's bring it all together. Whether you choose a topical gel like Erections, oral medications, lifestyle adjustments, or all of the above, the message is the same. You are not broken. ED does not define your worth. It does not signal the end of your vitality, your confidence, or your intimacy. It's simply a clue, sometimes subtle, sometimes urgent, about how your body is functioning. And the great news is, your body is adaptable. With the right tools, attention, and consistency, improvements are possible at any age. Think of sexual health as a mirror of your overall well-being. Improved circulation, stronger pelvic muscles, balanced hormones, and reduced stress don't just help in the bedroom, they enhance energy, mood, confidence, and quality of life. Starting today, small actions matter. Commit to daily movement, pelvic floor exercises, a heart-healthy diet, stress management, and regular checkups. Incorporate self-care routines, and if a gel or supplement fits your needs, use it as an aid, not a crutch. Remember, sexual function is a lifelong journey, not a race. Reframe the way you think about erections. They are signals, not achievements. They reflect how well you're caring for your body, mind, and heart. Age is not a limitation. It's an invitation to refine your approach, to honor your health, and to reclaim your confidence. The men I've seen in my practice, even in their 70s and 80s, rediscover intimacy, closeness, and pride in themselves, simply because they took proactive steps. It's never too late to start, and every informed decision compounds over time. Your best years are not behind you. They can be ahead, full of energy, freedom, and confidence. So here's your takeaway. Stay informed, stay proactive, and treat your sexual health as a vital part of your overall wellness. Use tools wisely, support your body with lifestyle choices, and seek guidance whenever needed. You deserve to feel strong, capable, and confident at every stage of life. Thank you for taking the time to learn, understand, and invest in your health today. I'm Dr. Narita, and remember, your body, your confidence, and your vitality are always within your control.